The 5th of March 2020 will be remembered by many as the day on which the first case of coronavirus was confirmed in South Africa. A year later, and the official statistics show that over 1 million cases have been reported in the country, with 50,462 confirmed deaths due to the virus. So let's now speak to Professor Mosa Moshabela, who is Dean of the School of Nursing and Public Health Care at the University of KwaZulu-Natal. Good afternoon to you, and thank you so much for joining us. And looking back from your perspective, how have we fared with COVID-19 so far as the #1 enemy of the world?
Colin, it's very difficult to really reflect on this. I think that in many respects, I think we have overcome. And I have to say that, a year ago, even when we were talking about vaccines, I would never have imagined. I don't know if you remember, we used to talk about 18 months to 24 months. I would never have imagined that at this point we would have a vaccine. But if you go back, really, at that time, there was just so much fear and anxiety of something that was coming. The idea of a storm, the calm before the storm. And we've been through 2 waves. And in the second wave, Colin, we've really seen the worst of what this pandemic is capable of. And we know that it can be worse because it's been worse in other places. But for us, it was really the worst, and we don't want to see that again. There was a lot of pain, a lot of death, a lot of mental health struggle for a lot of people. And so what I have learned, Colin, is that, as a people, we are a lot more connected than we like to think. People who traveled overseas can be connected with people who don't travel, and we can share the same disease. And also at the same time, the fact that when you're looking at a person with a disease, you would think of a disease, but actually it's a person. And we as healthcare workers, we also have to move away from looking after diseases. We must look after people, because these people come from certain communities with certain challenges. And we saw this during the lockdown, how one disease can disrupt many aspects of one person's life.
Yeah, Professor, people were a little bit apprehensive in terms of believing whether or not this virus was dangerous, and others were saying it doesn't exist, nothing will happen to them. But then it began to sink in as the year progressed, and as many people started to die. But also with the second wave, nobody believed that we would get to that. And now this issue of disbelief now is, when I spoke to you the first time, you said to me we shouldn't even be thinking about the third wave because we're not even going to get there. But now, talk of the third wave is now on the cards. What's your response?
Yeah, so, there is something about how in South Africa in general, we are reactive. We are not proactive. We wait for something to happen before we kick into action. We don't prepare ourselves for things that have not yet come, that have not yet happened. And we've got this sort of attitude of coping with life, like I'll cross the bridge when I get there. And so for us, I think it is really something that, Colin, we have to change, because I think that we now know that the more prepared we are, we can prevent problems. But we have to then learn how to benefit and enjoy having prevented a problem. If we had prevented a second wave, we would not have seen the devastation of the second wave, but we would not have known what we have protected ourselves from, what we have prevented. We can say the same thing with the third wave. And for me, I think that we now know that the third wave is very likely to happen. And in fact, it's almost like it's a done deal. It's going to happen no matter what. But we are a fighting people. We should not surrender ourselves to a third wave when we know what to do. There's a lot of things we can do to prevent or keep it low, minimize. Now, the question is, Colin, how do we do that? Invest in preventing a third wave, and then still benefit from that. Because if we succeed, people are going to say, oh yeah, of course it was not going to happen. These people were hyping up about nothing. And this is where I say we become victims of our own success. This is where my problem is. And I would rather we could prevent a problem rather than experience the devastation of it.
So now let's talk about the difference between a trial and a rollout. So many people have been vaccinated now, and it was trial and error. And now I would wonder what they are thinking themselves, and the people who have to be vaccinated, what is on their minds.
Okay, so I'm laughing about this, and I shouldn't laugh. It's not a funny issue, Colin, because, a number of times I have spoken about the way we use words, and people ended up calling me a professor of semantics. And I can gladly own that title, because this is exactly what I'm talking about. I mean, I was listening in the clip when Siviwe was asking about the difference, is it a trial or is it a rollout? These are, people say it's words, you can use them interchangeably. No, words mean something. And this is important. And people forget this, because if you get the words wrong, you're going to confuse people. And these meanings are attached to something. Someone who is in a trial, other people see that as being a guinea pig. Someone who is in a rollout, others see that as being owned by government. Now, when it's being owned by a research organization or a company, then these things they've got implications. So here, in the bigger scheme of things, for anyone who's getting vaccinated, it doesn't matter. Just get a vaccine. This is really important, to get a vaccine. However, it is important that you give consent to something that you understand. It's important that a healthcare worker knows that they're giving consent to get a jab under the circumstances of an implementation study. Whether that implementation study is approved and all of that then depends on the research body. Government doesn't have much to do with that. But if government is going to endorse the study, then they need to be able to say that we are partners in the study in order to increase access to vaccines. And it is not necessarily in itself a phase one of the government rollout, which is what was intended with the AstraZeneca vaccine. So these things are important to communicate very clearly. And I, as I say, I've been accused of, playing too much emphasis on semantics and words. But this is the consequence of not paying attention to words and how we communicate.
Okay, unfortunately, we have run out of time. I wanted to take you on the issue of how about if we could have heard from those who participated in the trials before we can even speak about members of the public or frontline workers being vaccinated. But we will do that next time, just that my time is up. And I don't want to call you the professor of semantics yet, but we'll talk next time. Thank you so much.
Okay. Thanks, Colin.
Okay, Professor Mosa Moshabela there, who is Dean of the School of Nursing and Public Health at the University of KwaZulu-Natal.